This video lecture will talk about immune disorders, specifically hypersensitivities. And so we'll see how that compares to the other major categories. Now, we've previously looked at autoimmune diseases where we had lymphocytes attacking cells. In a hypersensitivity, the name itself tells you there's an overreaction of the immune response to some particle, to some exposure. And part of the immune response is always a little bit of inflammation, but that massive overreaction of the immune response is going to cause a massive amount of inflammation. And so as that occurs, you're going to see that inflammation interfering with blood flow and lymphatic flow to the tissues. It's going to result in some compartment syndrome in various locations. It may cause collateral damage in the fact that it's going to bring in so many antibodies and so many white blood cells just attacking everything or having to dig through tissues, healthy tissues, to get to the foreign substance. It's going to damage tissues. It's going to wind up breaking up cells. It's going to interfere with blood flow, starving off tissues, causing infarction and necrosis. As all these blood vessels dilate during that massive inflammatory reaction, that's going to drop blood pressure, send the patient into shock. Lots of things that are happening as a reaction to this whole little flooding reaction. Now, there are four major types of hypersensitivities, and I want you to pay attention to what specifically has gone wrong to cause that type of hypersensitivity. The most common is type 1, or an anaphylactic reaction, what we tend to think of as an allergic reaction. In an allergic reaction, the IgE antibody will find its non-self antigen, bind to it, and IgE specifically will then also bind to a mast cell or a basophil, causing them to release cytokines such as histamine. And histamine will cause a lot of swelling and inflammation to occur. Normally, if you don't have an allergy to something, an IgE will bind to the non-self antigen. It'll kick a basophil or mast cell, and it'll cause a little bit of swelling. You'll get a little uh, raised lesion. So, for example, if you get a bee sting, you get a welt. But haptens are molecules that will cause IgE to overbind to that mast cell, so they don't just tap it and signal it once. They will cement to it and cause it to constantly release out more and more of the cytokines like histamines. Haptens can be a variety of molecules, such as the oils found in poison ivy or poison oak. Some haptens are common molecules that we react to, and some haptens are even produced uh, from a hereditary sense. The idea that you may produce a hapten molecule that tends to cause IgE molecules to specifically bind to strawberry antigens. And so it makes you allergic to strawberries. And if you pass on the gene that produces that specific hapten, then your child has the ability to potentially develop an allergy against strawberries. Now, it doesn't mean that they naturally will. They have to still overproduce their IgEs. So an anaphylactic reaction requires both, it requires three things. It requires an overproduction of IgE to that specific non-self antigen. It requires enough exposure of the non-self antigen to cause all of this bad stuff, and it requires haptens to make the IgE cause too much histamine. So anaphylaxis requires a whole combination of factors coming together. That's why not everybody in the world is allergic to peanuts. But some are if they have those three elements come together. Type 2 hypersensitivity is a cytotoxic reaction. Now, this is where your body has essentially a normal reaction to a non-self antigen. But the problem is that you get exposed to too much non-self antigen. So if we have a transfusion reaction, we give you a pint of the wrong type of blood. Now we're giving you several million non-self antigens, and each one of these can be attacked by your normal IgGs, IgMs, and IgEs. And that can cause a massive overreaction, overinflammation. Type 3 hypersensitivity is immune complex reaction. Now, this is where the IgG or IgM binds to its target, and that's going to cause the IgEs to tell mast cells to release some histamine. Now, normally, IgG and IgM will bind to their non-self antigen out in the plasma of your bloodstream, And so they might bump into an IgE, they might bump into a mast cell and release a little bit of histamine while your natural killer cells and your monocytes get rid of that complex. And that's normal. For a reason we don't understand, in some instances, these IgG and IgM complexes with their non-self antigens will embed into basement membranes, for example, in joint capsules. And now phagocytes, being attracted to that complex, will have to chew through the healthy tissue. Rheumatoid arthritis is an example of this reaction, chewing through the joint capsule, damaging your joints, causing massive inflammation and swelling in the joints and tremendous pain to get to these complexes. Don't know why it happens, which makes it very difficult to try and treat. Type 4 hypersensitivity is a delayed hypersensitivity. Now, this is where a normal immune reaction occurs within seconds. If you're allergic to something and you get exposed to it, your body will react within seconds. You'll know immediately if you eat a peanut and you're allergic to it, you'll start swelling up very, very quickly. With type 4 reaction, the antigen presenting cell, now remember, those are the little, those are phagocytes that find an activated antibody, present it to a T lymphocyte, which goes back to the thymus or to the spleen, saying send reinforcements. And that takes time, which is fine. Again, for a reason we don't know, something causes these antigen presenting cells to bypass the helper T cells and travel to the spleen and to the lymph nodes where they find memory B cells and cause them to overreact and produce a massive flood of antibodies, which go out and swarm all over their specific non-self antigen, which stimulates a massive immune reaction in that area. You get these big dollar-sized welts in poison ivy, poison oak, poison sumac, but this may show up hours later because it takes time for all of this traveling to the spleen, traveling back out again. It's a crazy mess. You see an example of a tuberculin skin test. This is where we can check to see your reaction to the TB antigen. And so this is where we're looking to see how much of a reaction, if we put a little bit of TB antigen under your skin, how many antibodies you have normally floating around. If you have a normal reaction, it's a small size, and I can't remember the exact number. But if you have a hypersensitivity, you are specifically allergic to TB, you'll get a big welt like this, and that tells us that if you're a healthcare worker and we have a TB patient on the ward, we're going to assign you to another ward so that you don't have an allergic reaction. Here's a patch skin test doing the same thing, only now we're testing more than just the one antigen. Each one of those little white discs has a small bit of a different type of antigen that we're putting up to the skin, and we can see, for example, a considerable reaction over here, a smaller reaction here, and many of these have almost no reaction. And so we can see, we can test a whole lot of different antigens at the same time. I feel really bad for this person with all that hair because they didn't shave when they put all this adhesive tape on here. They're gonna have to. Oh, that's just not gonna be fun. Ooh, ouch. Two terms that I do want to make clear for you are sensitization versus desensitization. Sensitization is a bad thing. Sensitization is where you develop a sensitivity to an antigen and you form an allergy. And this is where you're exposed to some non-self protein, you increase your production of IgE and or you increase your production of haptens. Either one of these gets you more sensitive towards having allergic reaction. Desensitization is a procedure that we can use to help reduce an allergic reaction. And so if you are allergic to strawberries, we can take you through a desensitization protocol where we will give you tiny doses of strawberry. And we will hopefully increase the amount of IgG that you have in your bloodstream, which will elbow out the IgEs, keep their numbers down, and so therefore they don't stimulate the basophils and mast cells to overproduce the histamine. You'll still have a normal immune reaction, just not an allergic reaction. So if you're sensitive to something, you want to reduce your sensitivity, there are desensitization protocols. They may or may not work. And so it's a little trick each time. So we're always very careful to perform them very carefully. But make sure you understand the difference between sensitization and desensitization. Transfusion reaction, we talked about that in type 2 hypersensitivity. You can imagine if all these little antibodies sticking out of, or these antigens, excuse me, sticking out of the red blood cell, if you're suddenly exposed to antibodies that would bind to the same thing, they're going to wind up cross-linking and agglutinating all of these red blood cells, making massive clumps. That's going to plug up your bloodstream. That can wind up causing tremendous anaphylaxis and shock and death. Here's an example of a delayed dermatitis. And so this would be a delayed hypersensitivity where the person was exposed to some oil, probably in a lotion. And over time, they started forming all these little welts all over the skin because the lotion, the oil, seeped in, did something weird to the antigen presenting cells, went to the spleen, and sent back a storm of antibodies. We'll clean them off, we'll clean out the oil, and we'll simply give them some anti-inflammatory to let the body go back to a normal standing until everything resets. This table can give you a nice quick little review of some of the most common details you'll see in the four types of hypersensitivities. Make sure that you can describe each hypersensitivity and specifically what has gone wrong to cause that type of hypersensitivity. All right, that's our little lecture on hypersensitivities. Take the time to review through each one of these, make nice little note cards so that you can describe each type of hypersensitivity and an example of how one of those can form and how it can present. Good luck.